Good evening. I am Tito, Liotta, orthopedic surgeon who focuses mostly on shoulder. We have Hannah Cruson, who's on that end, an athletic trainer and shoulder model for tonight. We have Liz, who's physical therapist with Valley View and resident shoulder guru and very much outside the box thinker. And then we have Aaron Flores, who's my physician assistant and beyond an excellent right hand person. Tonight, we're going to talk about why we get into trouble with our shoulders. It's not just how we're born, it's not just what we do with them, but it's the posture and position that we achieve that gets us into trouble. And so with that, I'm going to let Liz kind of talk to you about her part, and then we'll answer your questions when she's done.
And a couple housekeeping items to address before we get started. You can submit questions to the Q&A chat at the bottom of your screen. Your question could be answered live at the end of the presentation. We will try our best to answer your questions. We are unable to answer questions regarding personal health information.
Awesome. So thank you all for attending this evening. I want to start by thanking our team here at ValleyOrtho for their collaboration tonight. And I also want to thank Valley View University for the opportunity to present this topic. So I am a physical therapist. I've been practicing at Valley View for 12 years, and I specialize in orthopedics and hand therapy. So tonight we're going to get started with the shoulder struggle, how posture shapes pain. So a little disclaimer, the content that we're going to present tonight is for information purposes only and shouldn't take the place of an actual doctor's visit. So our objectives, we're going to understand posture's role in shoulder pain. We're going to identify common patterns of dysfunction at the shoulder blade. We're going to learn some practical corrective exercises. And then we're going to discuss some resources for equipment and exercises at the end of the presentation. So how did we arrive at this topic? Well, we were charged with creating a topic that would cover a wide scope of our community and incorporate some tenets that we commonly see in the clinic. As Dr. Liotta can likely attest, we rarely see patients in our practices that don't have some level of posture abnormality or pain associated with the way they move. And so therefore, we thought it was best to talk about this topic also in terms of which came first, the chicken or the egg, or which came first, poor posture and shoulder pain, or shoulder pain and poor posture. So as we move into our presentation, it's important to have a basic understanding of anatomy around the shoulder. So the first major bone we're going to talk about is the clavicle or the collarbone. And it's the only place that your shoulder actually connects to your axial skeleton. Next, we're going to talk about the scapula or the shoulder blade, and it's a large triangular bone that sits on the back of your rib cage. And we're also going to talk about the humerus or the upper arm bone, which is what supports us for all of our motion with daily activities. It's important to note that the shoulder blade and the upper arm bone have a tremendous amount of movement, and that movement requires a lot of muscle activation. So when we think about muscle groups that support the shoulder, we can divide this into an intrinsic group, which is located on the right side of the screen. Those are the muscles closest to the shoulder blade. And we can talk about the extrinsic group. So these are the muscles that specifically allow us to move our arm. In total, there are 14 different muscles that connect to our shoulder blade. And therefore, we have a lot of influence on these posture muscles as we move through our day. In fact, if we look at the forces around the shoulder blade, we can see that there's a tremendous amount of force pulling in all of these different directions. That serves us well in terms of movement, but does not serve us well in terms of control. So now that we understand basic anatomy, let's understand basic posture. So posture alignment in our clinic is assessed from multiple angles. I'm going to talk about the simple angle, which is viewed from the side. The important thing that we want to keep in mind is that ideal posture aligns us perpendicular to the plane of gravity. When we're in a nice perpendicular alignment, it takes very little force to hold us into that position. So if we look at our common landmarks, we can see that good posture is reflected by a straight line from the ear to the edge of the shoulder, to the hip, to the knee, and down to the ankle. On the left and right of center, you can see what happens when we start to fall out of that alignment. We're going to talk about that deeper here in a moment. If we look at sitting posture, we can see that we can use similar landmarks. So we're still looking at the ear, the tip of the shoulder, the elbow, and the hip, but we also need to consider what happens with the waist and the knees. So how does this actually impact us as we move through life? So unfortunately, our modern conveniences don't support us in good posture habits. For example, we have many members of our community that have to drive extended distances to get to and from work, which invites some very creative postures when driving in the car. We have a wide population that continue to work from home in less than optimal desk environments. And then we have an era of technology that forces us into some really awkward positions when we're using our devices. So what this actually means is we can get some cumulative stress around the shoulder over time. So this is what we call a pain map. And this is just showing you the relationship that we'll commonly see from poor resting static posture. So we see some referred pain down the arm near the shoulder from neck muscles. And we can also see a headache pattern that comes into play when we strain these muscles too long in a poor position. When we look a little bit deeper at how the muscles are impacted, we can specifically think about muscles that are going to be under strain or overperforming versus those that are underperforming. And we can glean this information simply by looking at someone's resting position. So the muscles that are commonly overperforming are listed there for your information. On the left picture, you can see the upper trapezius highlighted in blue. In the center picture, you can see the pectoralis minor and the levator scapula. And those three are overperformers. And finally, we have underperforming muscles. Those are indicated in the yellow, highlighted as the lower trapezius, the rhomboids, and the serratus anterior. These muscles will also refer pain around the shoulder. And as we can see here, we start to get a lot of overlap and we haven't even moved yet, but this is a reflection of pain maps from all the muscle groups that we just talked about that are overperformers. So we're going to go another layer deeper and we're going to look at the shoulder blade specifically. And when we want to look at the shoulder blade, we need to define what we consider normal. So this is as close to normal as we're going to get. As you can see, there's a vertical line depicted on the spine, and there are two triangles in place of the shoulder blade. The shoulder blade is sitting nice and comfortably next to the torso. And we also see that the medial edge or the inside edge is vertical and parallel to the spine itself. So let's flash forward to what we actually see in the clinic commonly with people that have shoulder pain. These are the three most common patterns that we often find. First one is winging, when that medial border actually slips away from the torso and we don't have good control. The next one is tipping, when the bottom angle of the shoulder blade tips forward relative to tight chest muscles. And then finally, we have downward rotation, where that medial border is actually rotated down towards the floor. This also presents its own consequences. So now that we understand resting position and posture alignment, we need to start talking about how does this impact us when we move. So the way that we like to explain shoulder mechanics is the golf ball on the tee phenomenon. So the tee is represented in our shoulder blade, and the golf ball is represented as the head of our humerus. Now, if we're in optimal alignment and things are resting perpendicular, the force is balanced and the ball and the tee will stay in place. If the ball happens to move and the tee stays where it is, there's going to be some force required to keep it from falling. And if the ball moves and the tee stays still, the same can be implied where we have forces required to hold things in place. So when we examine this animation of how the shoulder blade moves dynamically with the upper arm bone, we can see that it's very much not static. So with a functional reach, technical difficulties, we can see that that shoulder blade has to rotate upward for us to have full normal motion. Now, for a second, if we pretend this person has optimal alignment that we showed in our first picture, things are going to move really quite well. If he has less than optimal alignment, in the examples that we showed with the 3 common patterns, we're going to have an alteration in this movement pattern. And ultimately, the tissues that get strained are the rotator cuff muscles. So what ends up happening is we kind of create this really nice stage for motor control and muscle dysfunction. As I mentioned at the start of the presentation, we have 14 different muscles that connect to our shoulder blade, and that's 14 opportunities for things to go a little bit haywire. Another way to think about this is a dance recital. If you've ever had the privilege of watching young performing artists in a dance recital, you'll know that they learn and they mimic off of each other. If someone near the front of that line falls out of rhythm, there's a really good likelihood that the other dancers around them are also going to fall out of rhythm. To the naked eye, we can see this as a partial interruption in their movement, but the performance still has to go on. The same can be said for poor shoulder blade function. We will still move because we need to for our daily habits. However, there's going to be a consequence. That consequence comes in the form of muscle imbalances, leading to tissue strain, leading to pain, and that pain can circle back to enhance our muscle imbalance and enhance our tissue strain. So when we think about how this plays in with our rotator cuff specifically, which is what many people come into our practices for, we can see that our pain maps get even a little bit more full with where these common referral patterns come from the rotator cuff muscles themselves. So to put this into application, we're going to do a little bit of a video demonstration. Now I'm going to invite Hannah to come up with me. Hannah has graciously agreed to be our model this evening, which is so wonderful. So I'm going to have Hannah turn and face the wall, and I'm going to use this model of the shoulder blade on her arm to kind of show where we are. So first thing we're going to have Hannah do is raise her arm overhead. We're going to see a nice rotation all the way upward. You would turn to the side and face me just so that we can see that. That's awesome. Now if you come back down, we'll go back to the wall. Now I'm going to ask Hannah to slouch. So she's going to find her best slouchy position. I can already see that her shoulder blade is tipped away from her body. Go ahead and raise your arm overhead. And we can see that she can still get there. Is that comfortable for you? Not really. Not particularly comfortable. If we look at her from the side, we'll notice that she's actually lost a fair amount of elevation as she's moved. Thank you, Hannah. We'll go back to the wall. Now, can you pull your shoulder blades way forward around your body? Okay, and now go ahead and try to elevate. Again, we see the motion is a little bit off. Is that comfortable for you? No, not comfortable for her in particular. And then finally, we're going to have her hold her shoulder blades down, which would represent that downward rotation. Go ahead and move. You can see that her shoulder blade never moves, so there's a lot of strain incurred for her to get her arm into a comfortable position. Is that comfortable for you? Not particularly. Thank you so much. So at this point, we've covered anatomy. We've looked at resting posture positions. We've talked about dynamic control. Now we need to talk about solutions, or what the heck we're going to do with regards to this motion. So you're going to have access to 2 QR codes at the end of this presentation. The exercises that we're going to discuss now are included in that information. I have a couple ground rules that I generally recommend for patients in my clinic with exercise, and I really recommend that you follow them at home as well. So first ground rule is we don't want any sharp pain that's incurred with exercises. The second is that we don't want pain that comes on as we're moving through an exercise, and we really try to avoid pain that lasts after we stop exercising. So if we stay within those ground rules, these are generally a safe area to start. So in the first video on the right, this person is performing a foam roller stretch to open up the chest walls. If you don't have a foam roller, that's totally fine. You can use a rolled up towel that's placed down the length of your spine just to create that space for your shoulder blades to fall open against gravity. On the left, we have someone performing a foam roller extension exercise. If you don't have a foam roller, you can also use a roll up towel that's about 4 inches in circumference. And this is important for, again, opening up the chest wall and helping with those stiff neck muscles. And finally, in the bottom half of the screen, this gentleman is going to be stretching some of those target tissues that tend to overperform. So he is going to brace his arm on a chair, turn his head the opposite direction, looking into his armpit, and gently pull forward. Recommendations for how long to hold these positions are also included in that handout that you'll have access to. So we've talked about mobility exercises, and now we need to address stability exercises. So the same 3 muscles that I discussed earlier that were underperforming are the ones that we're going to target with this conversation. We're going to start with the serratus anterior. And on the left-hand side, this is a simple exercise where this patient has put her arms against the wall. She's walked her feet away, and she is performing an isolated push-up with just her shoulder blades. The important factor here is to move slow and deliberately and try not to strain. If you need an added challenge, the column of pictures in the middle can show you some modifications by putting you in the plane of gravity, moving into a high plank, or using an unstable surface like a Bosu ball for added challenge. In the next video, we have what's called a wall slide. So this person has again walked their feet back slightly. They're going to keep some forward pressure into their arms as they slide their arms up the wall. We can make this exercise harder by adding a small band around the wrists so that we get more rotator cuff recruitment. Now we're going to focus on the lower trapezius. So in the first video, this person is laying on the stomach on the floor. I usually recommend you use a block of towels or pillows under your stomach just to create that healthy separation. And what we care about most in this position is how far you actually move your shoulder blades. The height of your arm is not the critical piece of this information because we really care about that shoulder blade position more than the position of the arm. In the next video, we call this a wall angel. So this person is standing with their arms touching the wall. They've rotated their hands back to touch the wall, and they're going to perform gentle elevation exercises within the limit of what their tissues allow. Finally, for activation, we're going to think about the rhomboids in the middle trapezius. In the first video on the left, this gentleman is performing what's called a band pull apart. So he's going to raise his arms in front of him, parallel to the floor, squeeze his shoulder blades together as he pulls his arm apart. Just like with the prone Y exercise, we want to think about how those shoulder blades pinch together, not how far the arms are able to extend away from the body. And next, we're going to see a woman perform an isolated shoulder row. So she is going to keep her elbows in the same position and just move her shoulder blades around her body. And that's going to target those middle muscles that are so important for the balance around our shoulder blade. We would be remiss if we didn't talk a little bit about gaining awareness or gaining control of your shoulder blade. So this is another common one for us. We call this the scapular clock. I would highly recommend that you practice this in front of a mirror or have someone grab a video so that you can see what your tendency is and where your control lies. So in the first video on the left, she's going to move her shoulder blade from the 1 o'clock position to the 7 o'clock position. And with repetition, this will help you gain awareness of where that shoulder blade naturally wants to rest against your body. Next, we're going to watch a video where she's moving from the 11 o'clock to the 5 o'clock position. And again, these are normal patterns that the shoulder blade has to move through on a daily basis. Repetition and practice here is really important and can be done throughout the day. Finally, we often get asked about gadgets and gizmos that can help us train our posture habits. So there's a wide variety on the market. These are just a few simple and common ones that we see or we get asked about. So in the picture on the left, this gentleman is actually wearing a sensor on his upper neck, and that sensor can give him cues or reminders about posture correction. It can also tell him what percentage of the day he's resting in an optimal shoulder blade in position. In the center, we have something called the AlignMed posture shirt. This is something that Dr. Liotta commonly recommends. It comes in two different styles for men and women. And you'll notice that there's strapping across the back, which is actually a reflection of those muscle groups that we've just been talking about. But it can also be used as a tool to help you relearn your position. And finally, in a very simple application, we can use two forms of athletic tape. There's a white tape that's placed on the skin first to protect the skin. And then there's a darker beige tape that's used to hold things in place. The reality of using these devices is that it's really important for you to gain your own muscle control and not rely on the device to hold you against gravity all day long. So in summary, we've covered poor static posture habits, and we understand how they contribute to shoulder pain. We've talked about poor control of the shoulder blade and how that can refer pain to the shoulder. We've talked about improving our resting posture and restoring muscle balance in a safe space to start. But again, if you're having struggles or having a lot of pain, please come talk to us. And what I hope you take away is that regular practice can provide lasting change and reduce pain around your shoulder when applied in a safe manner. So we'll click it to the last slide. This is 2 QR codes. The QR code at the top is a link to a program we call MedBridge. You will need the access code to see a copy of the exercises that we reviewed tonight. The QR code on the bottom is linked to Amazon to discuss some of the exercise equipment that we reviewed this evening. I think with that, we will open it up for Q&A.
That's perfectly. So you want to minor.
What are the shoulder movements that can contribute to popping when rotating the shoulder/arm?
You know, it's not really about movement that creates the popping. It really depends on the pathology in the shoulder. And there's many things that can go wrong or can be problematic to create popping. Certainly after surgery and before your coordinated rotator cuff strength and scapular control, then you'll pop because the mechanics are off. And instead of the ball being held straight in the joint, big muscles will overpower the dysfunctional rotator cuff because it's either weak or tight, and you'll pull up and that'll make noise as you rub on your bony roof. But you can have a cartilage tear, you can have inflammation, you can have instability that can lead to popping in your shoulder. So it's very individual and specific, but in general, it's more elevation away from your body kind of things that create that noise.
What's the best treatment for tendinosis?
Tendinitis?
Tendinitis.
Ooh, that is about a topic for a week-long conference. Because tendinitis can stem from many different things. Number one, the rotator cuff is a rope, and it's a rope we use all the time. And it's been used since we were teeny tiny people and every second of every day. So over time, it does fail. As the tendon fails, the mechanics can become off, both whether posture, occupational, sports, and the tendons can get overused and they can become sore. So first, it's quiet down the soreness. Second, it's correct the things that Liz talked about. It's really holding your posture correctly, getting better motion, and then it's trying to achieve strength if we can quiet down the soreness. The sort of more advanced things are medication, anti-inflammatory medications, even more advanced, which we don't do very often, is a steroid injection in conjunction with PT. Because without good exercise and trying to correct the issues, cortisone doesn't really do much in my mind.
Yeah, I would echo that. There's a lot of studies in physical therapy that will show us if we can calm down the symptoms from a tendonitis, we have a really good chance of restoring normal mechanics. And that's where some of those medications or injections can come in, but it has to be tailored with someone that's going to correct the movement, or we're not actually going to get to the cause of the problem.
Does posture exasperate frozen shoulder?
No, I think the frozen shoulder takes the normal sort of synergy between the shoulder blade and the shoulder joint and throws it way off. And so the shoulder joint won't move because it's stiff, which is what frozen shoulder is, for whatever reason it's happening. And therefore the shoulder blade has to do a lot more motion to be able to elevate, to be able to rotate. And that shoulder blade hypermobility can throw your posture off, can make things more uncomfortable, can create overuse issues with muscles that just aren't used to working that hard.
Any suggestions for ideal posture while working at a standing desk?
Oh, wow. That's also a loaded question that could be a week-long conversation. So, first and foremost, I support movement throughout the workday. I really encourage it with all of my patients. If you're going to be a person that elects to stand all day, we really need to probably zoom out and think about your core strategies a little bit lower. So we think of that abdominal core kind of supporting us over our pelvis. And then we can also think about the shoulder blade as its own core for optimal posture and alignment and positions. The big one that I see that's a common failure with desk postures is standing with body weight shifted to one side more than the other, or one foot in front of the other, and just thinking about how much that changes our alignment through our entire spine. If you want to do a little experiment at home or at the workplace and there's someone that you can trust, have them snap a picture of you. You might think that you're in optimal alignment, but sometimes if someone does a drive-by view, you might actually see, wow, I had no idea that I was standing that way. And that can be a really useful tool if you're trying to self-monitor.
And as awkward as this sounds, the floor is connected to your shoulder. And so they've done a lot of occupational studies looking at people working overhead. And if they're, as an example, there's a guy at a Toyota plant and he was painting like this on the undercarriage all day long, had lots and lots of shoulder pain. They showed him to come under here and take a step forward and his pain went away. Or a baseball pitcher that throws with his arm and isn't using his pelvis and such, has a ton of shoulder pain. You don't do anything with the shoulder. You work on the mechanics of the hip and their shoulder pain goes away. So the pain and posture are from the floor all the way up through your body. If your pelvis is tight, if your hamstrings are tight, your back isn't correct. I mean, there's so many things that we as day in, day out desk users can do to modify just whether it's boredom of standing in one position or discomfort that can throw us off. And the hard part is our brain and our shoulder blades, as well as our shoulder joints, are very poorly connected. And I think that the hardest thing for a therapist to do is to get a patient to coordinate that shoulder blade posture, shoulder position with the appropriate use.
What popular sports, both summer and winter, that are pursued in our community pose the greatest risk to overall shoulder health?
So in my world, the biggest sport that we see are guys in construction. And as dumb as this might even sound, those guys are professional athletes. They basically use their body for their livelihood. And we see a ton of those. But if you think about the common sports, kayaking, very difficult to control your shoulder in that, especially class 4, class to class 6 water kind of situation. Biking, falling, poor position on your bike can be a problematic thing. As far as the winter sports, probably more falling is an issue than overuse kind of things. Certainly if you're skating weird as a skate skier or as a classic cross-country skier, you can create some trouble, but skiing as a sport or the winter things aren't so much trouble. We do have some climbers who get into trouble, and that's a lot of them are just climb and they don't really work on the overall shoulder. Swimmers, again, just swim and they don't work on the overall shoulder. And so without doing a concerted shoulder health program along with your sport can get you into trouble with all kinds of different sports.
Any more questions before we wrap up? Feel free to put them in the Q&A. Someone said, thank you, well done, clearly analyzed and presented.
We really appreciate you guys taking time and effort to be here and to take time out of your day. And hopefully this was useful and entertaining as well as information.
All right, we will wrap it up. Our team would love to hear your feedback on today's presentation. If you have time to fill out a quick survey, it will appear right after the webinar has ended. You will receive an email with the recording of the webinar and the QR codes within the next 24 hours. Thank you for joining.